Hi, everybody. My name is Kaylin, and I'm presenting this work for Neurobiology of Trauma. I wanted to say welcome to my presentation on the neurobiology of childhood trauma. Today, we will explore how early adversity literally reshapes the brain and body, influencing emotional development, learning, behavior, and long term health. This information helps us understand why trauma informed care is so essential. Thank you for listening as we explore this important topic. Here's an overview of what we'll cover. First, we'll define what childhood trauma is and why early experiences have such a powerful impact. Then we'll look at the specific brain systems most affected by trauma, such as the amygdala, hippocampus, and prefrontal cortex. We'll also explore how trauma changes stress hormones and the developing nervous system. After reviewing these changes, After reviewing how these changes show up in children's emotions and behaviors, we'll look at treatments that help heal trauma from a neurobiological perspective. Finally, we'll consider the implications for clinical practice in child serving systems. Childhood trauma refers to experiences that overwhelm a child's capacity to cope. Experiences involving threat, harm, or extreme stress. These can include abuse, neglect, domestic violence, witnessing violence in the community, or other frightening events. The key point is that these events occur during periods of rapid brain development. Because children depend so heavily on caregivers for safety and regulation, trauma experienced in relationships is especially disruptive. Research shows that childhood trauma is strongly associated with long term emotional, physical, and cognitive health difficulties. The ACEs framework helps us understand how widespread trauma is. ACEs include abuse, neglect, and household dysfunction, such as parental mental illness, substance use, or domestic violence. Studies show a strong dose response relationship. The more ACEs a child experiences, the higher their risk for mental and physical problems later in life. The original CDC Kaiser study by Filidi and colleagues demonstrated that early trauma contributes to many leading causes of adult morbidity and mortality. Neurobiology helps us understand the mechanisms behind this, how stress gets embedded in the developing brain and body. Childhood is a period of enormous neuroplasticity. The brain forms connections rapidly and prunes away those that aren't used. Emotional and threat detection systems mature earlier than areas involved in reasoning or regulation. The prefrontal cortex, which helps with impulse control and planning, continues developing into the mid-20s. Trauma occurring during these sensitive windows can alter the trajectory of development. In other words, early experiences are not just remembered, they are biologically built into the architecture of the brain. The amygdala is the brain's threat detector. In children who experience trauma, the amygdala often becomes overactive and hypersensitive. This may lead to hypervigilance, exaggerated startle responses, and interpreting neutral situations as threatening. Brain imaging studies consistently show heightened amygdala activation in children exposed to abuse or chronic stress. This helps explain why traumatized children may seem constantly on guard or reactive. It's a biological adaptation to a dangerous environment. The hippocampus helps us form coherent memories and understand the context of experiences. Chronic stress, particularly during childhood, can reduce hippocampal volume. Children may have difficulty forming consistent narratives about what happened. Trauma memories may be fragmented, sensory based, or disorganized, which can contribute to intrusive symptoms. Difficulties distinguishing past from present can keep children stuck in fear responses even when the danger is no longer present. The prefrontal cortex is responsible for planning, attention, impulse control, and emotional regulation. Childhood trauma weakens the communication pathways between the PFC and the amygdala. This means children may struggle to regulate emotions or behavior even when they want to. Tantrums, impulsivity, or shutting down can reflect underdeveloped regulatory circuits, not willful defiance. Because the PFC, prefrontal cortex, develops so slowly, trauma during childhood and adolescence can have lasting effects. The HPA axis manages our stress response by releasing cortisol. In a healthy system, cortisol rises during stress and falls afterward, but chronic trauma disrupts this rhythm. Some children show chronically elevated cortisol, while others show unusually low levels, reflecting a burnout of the stress response. Either pattern can create problems in mood, regulation, sleep, immune function, and learning. These biological changes explain why children exposed to trauma may be more prone to anxiety, depression, and physical health issues. The autonomic nervous system has two branches. One helps us mobilize during stress, fight or flight, and the other helps us rest, connect, and feel safe. Polyvagal theory highlights the role of the vagus nerve in social engagement. Trauma can keep children stuck in defensive states, hyperarousal like anxiety and agitation, or hypoarousal like shutdown or dissociation. These states interfere with play, learning, and relationships, often creating cues of safety, and using co regulation are key parts of healing. Healthy attachment helps shape the developing stress system. When caregivers are responsive and consistent, a child's nervous system learns to return to calm. But when caregivers are frightening, unpredictable, or unavailable, often because they are overwhelmed themselves, children must manage overwhelming emotions alone. This can lead to insecure or disorganized attachment patterns. Trauma sensitive care emphasizes building reliable, attuned relationships that help children regulate. Trauma has major impacts on learning. Children may rely more heavily on implicit memory, sensory or emotional memories, rather than explicit verbal memory. They may have trouble concentrating, organizing information, or retrieving memories. Flashbacks or intrusive thoughts make it difficult to stay present. In classrooms, this can look like attention problems or disengagement. Trauma informed education recognizes these behaviors as signs of stress physiology, not lack of motivation. One of the most fascinating areas of trauma science is epigenetics, the study of how experiences affect gene expression. Trauma can cause chemical changes that turn certain genes on or off, particularly those related to stress regulation. These changes don't alter DNA itself, but they can influence how the body responds to stress throughout life. Some epigenetic changes may even be passed down to the next generation. Importantly, supportive environments can sometimes reverse or soften these effects. Early trauma is associated with chronic inflammation in the body. Stress hormones can alter immune system functioning, leading to increased inflammatory markers. This contributes to the long-term physical health risks seen in trauma-exposed individuals, such as heart disease, diabetes, and autoimmune conditions. Trauma is not only a psychological experience, it has deep biological effects across systems. Children express stress through behavior. Hyperactivity, impulsivity, irritability, aggression, withdrawal, dissociation, and somatic complaints are common. These are often misunderstood as behavior problems when they are actually survival responses. Many traumatized children operate from a chronically activated nervous system. Trauma-informed approaches emphasize responding with compassion and regulation strategies rather than punishment. Trauma symptoms often resemble ADHD, oppositional defiant disorder, anxiety disorders, or mood disorders. Without asking about trauma, clinicians may misdiagnose children and miss important aspects of their experience. For example, a child who fidgets and startles easily may look like they have ADHD when they are actually in a hyper-aroused state due to trauma. Understanding trauma's neurobiology helps us see behaviors in context and avoid mislabeling. Post-traumatic stress disorder in children includes re-experiencing, avoidance, negative mood changes, and hyperarousal. These symptoms are rooted in the brain systems we discussed: an overactive amygdala, underactive prefrontal cortex, and dysregulated stress hormones. Children may also regress in behavior or become extremely clingy. Understanding the brain mechanisms helps guide targeted treatment. Trauma-focused cognitive behavioral therapy, or TFCBT, is one of the strongest evidence-based treatments for childhood trauma. It includes psychoeducation, coping skills, gradual exposure, and creation of a trauma narrative. Caregivers are usually involved to support regulation at home. Brain imaging research shows that TFCBT can reduce amygdala activation and strengthen prefrontal regulation, demonstrating actual neurobiological improvement. EMDR, which stands for eye movement desensitization and reprocessing, helps reprocess traumatic memories using bilateral simulations, such as eye movements or tapping. Children may use drawing or storytelling as part of the process. EMDR helps integrate traumatic memories in a way that reduces emotional intensity. It can be especially helpful for children who struggle to express trauma verbally. Research suggests it may also influence neural networks involved in memory and emotional regulation. Somatic therapies focus on physical sensations, movement, and body awareness to help children process stored survival responses. Play-based therapies use toys, art, and role play to help children communicate and integrate experiences in developmentally appropriate ways. Many of these approaches draw from polyvagal principles emphasizing safety, rhythm, and co-regulation. Because trauma is stored in the body, bottom-up approaches are often essential. One of the most hopeful aspects of trauma science is neuroplasticity, the brain's ability to reorganize and heal. Safe relationships, therapy, and regulated environments can actually reshape neural pathways. Even children with severe early adversity can develop healthier stress responses over time. This means interventions can truly change developmental trajectories. Resilience develops when children have protective factors that buffer stress. The most powerful of these is a strong, supportive relationship with at least one stable caregiver. Other factors include predictable routines, emotional coaching, safe environments, and access to support services. Resilience does not mean children are unaffected, it just means that they have the resources to adapt and continue developing. Trauma does not occur in isolation. Cultural and environmental factors, such as poverty, discrimination, and community violence, increase stress exposure. These chronic stressors can heighten biological vulnerability. At the same time, cultural strengths, such as extended family networks, spirituality, or community traditions, can support resilience. Trauma-informed care must always consider cultural context and avoid pathologizing normal responses to adversity. Childhood trauma can have lifelong consequences. Adults with high ACE scores are at increased risk for depression, anxiety, PTSD, substance use, chronic illness, and early death. Relationship difficulties and challenges with employment or parenting are common. Understanding the neurobiological pathways from childhood to adulthood help us recognize trauma as a major public health issue, not just as a mental health problem. Trauma-informed practice extends beyond therapy. Schools, pediatric settings, child welfare systems, and juvenile justice programs all interact with children who have experienced trauma. Trauma-informed systems prioritize safety, predictability, collaboration, and empowerment. This reduces re-traumatization and promotes healing. All adults who work with children can play a role in supporting regulation and resilience. On this slide, we will look at a brief case example. Maria is a 9-year-old who witnessed domestic violence at home and experienced emotional neglect. She now has nightmares, irritability, and difficulty concentrating in school. Neurobiologically, Maria's amygdala is likely hyperactive, and her stress system is on high alert. Treatment might include TF-CBT, caregiver support, and a trauma-informed school plan. This example shows how understanding brain-based changes can inform effective intervention. There are 3 main takeaways from the neurobiology of childhood trauma. First, trauma fundamentally shapes developing brain systems involved in threat detection, memory, and regulation. Second, many behaviors seen in traumatized children are adaptive survival responses. And third, effective interventions can change these patterns through safety, relationship, and skill building. Understanding trauma at a biological level helps reduce stigma and increases empathy. In summary, childhood trauma affects the brain, body, and emotions and behavior. These impacts occur during sensitive developmental periods when neural systems are still forming. The good news is that healing is also possible through neuroplasticity. Supportive relationships and evidence-based treatments can help children develop healthier stress and regulation patterns. No matter your role, whether you're in education, counseling, social work, nursing, or another field, you can support healing. Trauma-informed practice involves seeing behavior through a brain-based lens, prioritizing safety, and offering consistent support. It means responding with compassion rather than judgment and advocating for systems that understand and accommodate trauma-affected children. These are the peer-reviewed sources used to support the information in my presentation. Thank you for listening.